Ever find yourself, clicking around online, maybe trying to understand something new, and you hit a topic that just seems really strange?
Oh, definitely. That's kind of where we landed with today's topic.
Yeah, we were looking into feline hyperesthesia syndrome.
Exactly. We have some pretty detailed medical info here on it, and it's a peculiar condition in cats. Really makes you think.
It really does.
Yeah.
I mean, imagine your cat, totally calm, 1 second, and the next. It's like they're suddenly reacting to something invisible, maybe acting super agitated.
Yeah, making strange sounds or maybe obsessively licking or biting their own back or tail.
It's the kind of thing that, as an owner, would really worry you. You just want answers, right?
Absolutely.
Right.
And that's kind of our goal with this deep dive. We're going to take this medical overview we have and just explore the syndrome.
Okay, so what it is, which cats seem to get it.
Uh-huh. And what the current thinking is on the causes, though, honestly, the unknowns are a huge part of this story.
Right, and then how vets actually diagnose it and try to manage it.
Yeah, hopefully give you a solid handle on this puzzling condition.
Okay, so let's start right there. What exactly is feline hyperesthesia syndrome? The source uses the term idiopathic disorder.
Right. And idiopathic, for anyone not familiar, basically just means the cause isn't known.
So mystery number one, right off the bat,
Yeah.
not straightforward.
Not at all. But it is defined by these sudden episodes, these spells of agitation, and some pretty specific physical things you might see.
What kind of things are we talking about?
Well, the overview highlights a few key signs during an episode. One of the most noticeable is often this twitching of the skin,
Whereabouts?
especially along the lower back, the lumbar area. It can look almost like ripples under the fur.
Yeah, I can picture that. Like something's crawling there.
Exactly. And you might also see muscle spasms, specifically in what they call the epaxial muscles.
Okay, epaxial muscles, those run along the spine.
That's right. On either side of the spine on their back, you might see them kind of bunch up or twitch.
And then there's the noise.
Yeah. Sometimes intense vocalization, meowing, maybe hissing, even crying out. And like we touched on that, focus on licking or biting their back, their tail, sometimes even their back legs.
It sounds really quite distressing for the cat.
It certainly seems to be. The overview also mentions other potential signs like dilated pupils, big pupils.
Which can signal stress or excitement.
Right. And some cats might get aggressive during an episode or just start running around frantically like they can't escape something.
But these episodes, they don't last for ages, do they?
No, thankfully not. Usually just several seconds up to maybe a few minutes.
And then what happens?
Well, this is really key. Between the episodes, the cat is typically completely normal.
Completely normal. Wow. That must make diagnosis tricky.
It does. It's a huge clue for vets, though. Another interesting point from the source. Many cats with this syndrome really don't like being petted along their back.
So something that's usually nice for them.
Can actually trigger an episode in these cases. Yeah.
That's a really important detail for owners. Now, say you take a cat experiencing this to the vet. What does a normal checkup usually show?
Well, interestingly, the general physical exam itself is often unremarkable, normal.
Really? Even with all that licking and biting?
Well, you might see some evidence of that, like maybe some hair loss or broken fur on the lower back or tail from the self-trauma.
Okay.
But otherwise, usually no obvious physical problems. However, the overview does point out if the vet palpates, feels along those back muscles.
The cat might react.
Yeah, many cats will react negatively, and it could even provoke an episode right there.
Okay, so that's telling. But the report also specifically says no neurological deficits are present. What does that mean?
It means their basic nerve functions seem okay. Coordination, reflexes, strength, those usually test out normal.
So it's not like a typical nerve injury or disease causing those signs.
Doesn't seem to be, no. Which helps narrow things down, rule out other conditions. And it's worth mentioning this syndrome has gone by other names too.
Oh.
Things like rolling skin disease, neuritis, even psychomotor epilepsy. It just shows people have been trying to figure out what exactly this is for a while.
Okay, so we've got a picture of what it looks like, but who gets it? Is it any cat, or are some breeds more likely?
The overview states pretty clearly that any breed can be affected, so it's not exclusive.
Right.
But it does seem there might be a higher predisposition in certain breeds. They specifically call out Siamese, Abyssinian, Burmese, and Himalayan cats.
Interesting. Makes you wonder about genetics.
It does. So while any cat can get it, maybe keep an extra eye out if you have one of those breeds.
And what about age? When does this usually start?
The most common age for signs to first appear is between 1 and 5 years old, so fairly young adults.
But not always.
No, the overview is clear signs can occur at any age, so it's not strictly limited to that young adult window.
All right, so the big question then, what actually causes feline hyperesthesia syndrome? This is where that idiopathic thing comes back in, right?
Exactly. The underlying reason, the pathophysiology, it's just not well understood. That's probably the biggest challenge here.
But there must be theories. What are researchers looking into?
Oh, definitely theories. The overview mentions a few main possibilities. One idea is that it's fundamentally a behavioral issue.
Like what?
Maybe a form of obsessive-compulsive disorder, but, in cats.
Okay. What else?
Another strong contender is that it could be a type of focal seizure disorder.
Focal meaning localized.
Yeah, like a small specific area of the brain having a brief electrical misfire rather than a big generalized seizure.
And the third idea?
Is that it might be a localized nerve or muscle problem right there in the back area, a sensory issue, making that spot hypersensitive. Hyperesthesia means heightened sensitivity.
So brain, behavior, or maybe the nerves and muscles in the back itself. Could it be more than one thing?
That's also suggested. It might be multifactorial, several things contributing, or maybe what we call FHS isn't even one single condition.
Like it could be a collection of similar symptoms, but with different root causes, depending on the cat.
Precisely. We might be grouping different underlying issues together under one umbrella term right now.
That makes a lot of sense.
Uh-huh.
Does the overview mention any risk factors? Things that might make a cat more likely to develop this?
It does note one potential factor. Cats that tend to be more nervous or hyperexcitable in general might be more prone to it.
Okay, so personality could play a role.
Seems possible.
Yeah.
Which kind of links back to that potential behavioral component, doesn't it?
It does. And stressors.
Yes. Environmental stressors are also mentioned as potential triggers for episodes in cats that are already susceptible.
So like a move or a new pet or even loud construction nearby.
Yeah.
Those could potentially set it off.
That seems to be the thinking, yes. Which means managing the cat's environment could be really important.
This definitely sounds complex to pin down. If there's no single test for it, how on earth do vets diagnose feline hyperesthesia syndrome?
That's a great question. And the overview emphasizes it's really a diagnosis based on a few things. The cat's history, those specific clinical signs we discussed.
Skin twitching, the licking, the agitation.
Right, and then crucially, ruling out other medical conditions that could cause similar signs. It's very much a process of elimination.
Okay, so what kinds of things need to be eliminated? What are the main lookalikes?
The overview lists several key categories. First, they need to rule out dermatologic conditions causing intense itching, what vets call pruritus.
Skin problems, like what specifically?
Things like fleas, of course, but also various mites, nodoedris, Shaleatiella, fungal infections like ringworm, and allergies.
How do they check for those?
Usually with things like skin scrapings to look for mites under a microscope or fungal cultures for ringworm. Allergy testing can be more involved.
Makes sense. An itchy cat is definitely going to lick and maybe act agitated. What's next on the rule out list?
Diseases of the vertebral column, the spine that could be causing pain.
Spinal pain. Okay.
Yeah, things like degenerative disc disease, inflammation like discospondylitis or meningitis, even tumors affecting the spine, or trauma.
And how do they investigate that?
Radiography x-rays of the spine is common, sometimes more advanced imaging like CT or MRI, or even analyzing cerebrospinal fluid might be needed depending on the case.
So imaging helps figure out what it isn't, even if it doesn't directly show hyperesthesia itself.
Exactly. Then they also need to consider problems in the forebrain, the front part of the brain that could cause behavioral changes or seizures.
Like what kind of brain issues?
It could be metabolic, like problems related to liver disease. Infectious or inflammatory causes are big, two things linked to FeLV, FIV, FIP, or infections like cryptococcosis or toxoplasmosis.
Yeah, a lot of possibilities there.
And also, unfortunately, brain tumors or even vascular events like a stroke.
How do they check for those?
That might involve more blood tests, specific tests for infectious diseases, analyzing that spinal fluid again, or advanced brain imaging like MRI or CT scans.
That's quite a workup. Anything else?
Yes, finally, they have to consider if it could be primarily a behavioral condition, like a compulsive disorder we mentioned earlier.
But that's usually after ruling out the medical stuff.
Often, yes. It becomes a diagnosis by exclusion when other causes aren't found.
So It's a really systematic investigation. What about just standard blood tests, like a CBC or chemistry panel and a urinalysis? Do those usually show anything?
Interestingly, the overview says those routine tests are frequently normal in cats with FHS.
Ah,
It does mention that occasionally increased globulin levels, a type of protein, have been reported, but it's not a consistent finding.
so basic labs are helpful for overall health and ruling out other issues,
Yeah.
but probably won't give you the FHS diagnosis itself.
Generally, no. And other standard tests or imaging aren't usually required for the FHS diagnosis, but are rather to exclude those other possibilities.
Okay. The overview does mention a couple of more specialized tests, though. EMG and muscle biopsy.
Yes, though not always done. Electromyography, or EMG, measures electrical activity in muscles. Sometimes it might show abnormal spontaneous activity in the back muscles of affected cats.
Suggesting maybe the muscles themselves are involved somehow.
Potentially. And if the EMG shows changes, they might consider a muscle biopsy, taking a tiny tissue sample. The source mentions that in some cases they've found vacuoles, which are like little empty spaces, within the muscle cells.
So maybe subtle muscle changes in some cats.
Yeah.
Another piece of this complicated puzzle.
It seems so. It just highlights that we're still learning about the exact mechanisms.
It definitely sounds like a very involved diagnostic journey, relying heavily on observation and carefully ruling things out. So once a vet does land on a diagnosis of feline hyperesthesia syndrome, what happens next? What are the treatment options?
Right, management. The overview stresses treatment is typically done on an outpatient basis, so at home.
Okay.
And one of the very first steps, and maybe one of the most important, is trying to identify any environmental triggers.
Back to those stressors we talked about.
Exactly. If you can figure out what sets off the episodes, loud noises, certain interactions, changes in routine, and then minimize those triggers, that can make a big difference.
So creating a calm, predictable environment is key.
It really seems to be. Behavioral modification techniques might also play a role.
Like what?
Things like environmental enrichment, more toys, puzzle feeders, climbing structures to keep them mentally stimulated, maintaining a consistent daily schedule, sometimes trying to redirect their attention if you see signs an episode might be starting.
Distraction techniques.
Mm-hmm.
Okay. What about for cats who are causing actual harm to themselves with the biting and licking?
Yeah, for severe self-mutilation, unfortunately, sometimes in Elizabethan collar, the cone of shame is necessary.
Poor cats.
I know. Or sometimes bandaging the tail just to prevent further injury and allow healing.
Makes sense as a temporary measure.
Yeah.
What about medications? The overview lists quite a few.
Yes, and the choice of medication often depends heavily on what the veterinarian suspects might be the main driving factor for that particular cat. It's not one size fits all.
Okay, so if they suspect maybe an underlying itch component wasn't fully ruled out.
In that case, they might try a course of a corticosteroid, like prednisolone, to address potential inflammation or pruritus.
And what if the suspicion leans more towards a neurological issue, like those focal seizures?
Then antiepileptic drugs or anti-seizure meds are often considered. Phenobarbital is one mentioned.
They'll work well.
The overview says its effectiveness is variable. It helps some cats, but not all. It also provides general dosage info. Gabapentin is another option listed.
Gabapentin. I've heard of that for nerve pain, too.
Right, it has that dual action, potentially helping with both seizure activity and neuropathic pain, which could be relevant here.
Interesting. What if the vet thinks it's primarily a behavioral disorder?
Then they might explore medications that influence brain chemistry related to mood and behavior. The source mentions SSRIs like fluoxetine.
Like Prozac?
Yes. Also tricyclic antidepressants like clomipramine or even benzodiazepines like lorazepam for anxiety or compulsive behaviors. Again, dosages are suggested.
Wow, so it really sounds like a bit of trial and error, trying different approaches based on the suspected underlying mechanism.
It often is, yes. The overview also briefly mentions carnitine and coenzyme Q10.
What are those for?
Those are sometimes considered if there's a suspicion of an underlying muscle problem, a myopathy, maybe based on those EMG or biopsy findings we mentioned earlier, but that seems less common.
Okay. And how well does treatment generally work? Is this something you can cure?
The overview makes it clear that the response to treatment is quite variable. Some cats improve significantly, others less so.
And is it lifelong treatment usually?
For many cats that do respond well to medication, yes, it often needs to be continued long-term. Stopping the medication often leads to the episodes returning, so it's more about management than a cure.
That's a really important expectation for owners to have. The overview also flagged a potential drug interaction involving fluoxetine.
Yes, that's an important point. Fluoxetine can inhibit certain liver enzymes, the cytochrome P450 system, which are responsible for breaking down other drugs.
Meaning it could affect levels of other medications.
Exactly. It could potentially increase the levels or effects of drugs like phenobarbital, benzodiazepines, and tricyclic antidepressants if used concurrently. So vets need to be cautious with combinations.
Careful monitoring is definitely needed then. Speaking of monitoring, what kind of follow-up does a cat with FHS usually require?
Well, specifically for cats taking phenobarbital, the source recommends checking the serum drug levels, the amount in the blood, after starting treatment to ensure it's in the therapeutic range.
Makes sense.
Yeah.
Adjusting the dose if needed.
Right. And then periodic blood work like CBC and biochemistry panels maybe every 6 to 12 months, just to monitor for any potential side effects from the long-term medication use.
And in terms of prevention, besides avoiding known triggers, is there much else owners can do?
Unfortunately, because the underlying cause isn't truly known, the overview doesn't point to specific preventative measures beyond trying to maintain that stable, low-stress environment.
So it really boils down to recognizing the signs, that careful diagnostic process with your vet, and then finding the right management strategy through potentially trying different things. What's the overall outlook, the prognosis for these cats?
The source says the prognosis is variable. It really depends on factors like whether an underlying cause can be identified and treated, how well the individual cat responds to the chosen therapy, and just how frequent and severe the episodes are to begin with.
So some cats can be managed well, others might continue to struggle.
That seems to be the case, yes. Some can live relatively normal lives with good management, while for others it remains a significant challenge.
Okay, so wrapping up our deep dive on feline hyperesthesia syndrome. It really is a perplexing condition, isn't it? Characterized by these sudden, strange episodes.
Definitely perplexing, and the diagnosis relies so heavily on ruling out a whole host of other things.
Right, that process of elimination. And the treatment is quite tailored, depending on whether the vet suspects something neurological, behavioral, maybe even skin-related, or perhaps a mix.
Exactly, and that core mystery, the idiopathic nature, the unknown cause, that's the real kicker. It underscores how much more we need to learn about it. It's clearly frustrating for owners and challenging for veterinarians, too.
It really makes you ponder the connection between a cat's physical state and their mental or behavioral state, doesn't it?
It absolutely does.
Especially given the potential for both neurological and behavioral components here. You have to wonder, what might future research uncover about that mind-body interplay in this specific feline condition? It's fascinating.
A really interesting question for the future, definitely something that warrants more study.
For sure. So if you're listening and your cat shows signs like these, hopefully this has provided some context, but obviously the crucial step is always talking with your own vet to get the right diagnosis and care plan.